Hello, everyone. It's April 15th. I'm Dr. Adam London, Director of the Kent County Health Department. Usually this is tax day. If you're at home stressing about your taxes today on April 15th, relax. We've all received an extension to July 15th, so make sure those individual income tax forms are all submitted by July 15th for the state of Michigan and for the United States Treasury as well. Here for the daily COVID-19 update. Across the state of Michigan, we're now at 27,001 cases, which is an increase of 1,366 over the previous day, and 1,768 deaths across the state of Michigan as of today. Here in Kent County, we have a report this morning of 342 COVID positive cases in the county, which is an increase of 17 over yesterday. And sadly, we did learn about an additional death, bringing that total to 15 for Kent County. And our thoughts and prayers go out to that family and to all the families who are suffering in mourning, having lost loved ones during this pandemic. As you know, COVID-19 is a very serious illness. However, it's not the only concern that we have right now. We know that being sheltered in place and having the stress and fear that's associated with a pandemic is very stressful. And we're worried about the mental health of people in our community. I'm joined today over the telephone by Dr. Kiran Taylor. Dr. Taylor is the Chief Medical Officer at Hope Network here in Grand Rapids. And I'd like to have a conversation with Dr. Taylor about what people can do to protect themselves and their loved ones from mental health crises during this pandemic. Dr. Taylor, can you talk to us a little bit about your concerns and if you're worried right now about what this crisis is doing to the mental health of people in our community?
Yes, well, thank you for having me today. And there are reasons to be concerned about behavioral health of our communities in general, because when we have experienced a pandemic, such as we currently are with the COVID-19 pandemic, there can create a generalized sense of increased stress across our society and our communities. And our routines are disrupted. Daily functioning is challenged, how we access our needs and wants, how we interact with other people. And so these changes, understandably, all create some emotional strain. And then not to even mention the potential for physical distress if someone happens to get sick or has other physical diseases, and financial strain. So I think it's important that we all understand that it's okay if we're not feeling ourselves and we're going through stronger emotions or even different emotions. And figuring out how to cope with those feelings and then getting help when we need it is key.
I think that's I'm sorry, I was just saying, I think that's a great point that you made, that I think there are many people that feel like they're strong, they can handle this, and maybe aren't in tune with their own feelings and their own wellness. Is that something you're worried about? And what encouragement would you give to people to really be aware of their own health?
So, right, exactly. Practicing mindfulness in terms of being aware, giving yourself the time and space to feel different and feel more intense emotions, and trying to, again, be aware and mindful, and understanding how that influences, those emotions influence your thoughts or your actions, your relationships with loved ones. For those of us that are able to live with other people, are we noticing our loved ones changing in how they're behaving or becoming more irritable? Those are all ways that loved ones can help each other and monitor such things, because the more we can get ahead of recognizing emotional distress, then the more we can be proactive in doing something about it and figuring out how to be protective around those possible symptoms of mental illness.
Yeah, and so I think this is something that people have some awareness about generally as a problem. But when it comes down to that moment of crisis, what can people do to help themselves or to help loved ones?
Right. So then there's another part of the population, and really with mental illness affecting 1 in 5, it's a significant part of the population, and with depression being the leading cause of disability worldwide, major contributor to global burden of disease. There are many people out there who already have what we may call pre-existing mental health concerns, whether it's diagnosis of major depression, type of anxiety, post-traumatic stress disorder, obsessive compulsive disorder, or addiction type disorder, substance use disorders, all the way to developmental disorders or persistent mental illness. These individuals with these diagnoses and pre-existing conditions are all perhaps have increased vulnerability towards the stress, the generalized stress that our COVID-19 pandemic is bringing to all of us. So it's really important to monitor for worsening of symptoms and triggers. So identifying, for example, somebody, we are losing our routine and structure that is familiar with us. And so when you're in a crisis, being able to figure out, can you figure out, sometimes in crisis it's too overwhelming, and that's where really pulling in other people you can trust to help you regain your footing, to then understand what can you do to minimize those triggers and promote protective factors. So for individuals with pre-existing behavioral health concerns, please follow your treatment plans. And also please access your treatment providers as best you can. And that is really one of the key points also when you're in crisis is please reach out and access services and resources. Those are available, and we can get to more of those and how they're available later. But I think those are some of the key things that someone can do or a loved one can do when someone is experiencing a crisis.
Yeah, those are all great points, and I think that the community needs to realize that that these were major issues before COVID-19 arrived in the community and before these stresses and fears related to a pandemic. We had an epidemic of suicide in this community. We still do. We have an epidemic of substance use overdose in this community. And I think that this crisis is only going to serve to exacerbate some of those problems. And I think it's important that everyone realize that you are vulnerable to these things, and don't assume that you're not. I think that there are a lot of people who think that these problems are someone else's problems, and they really should appreciate the fact that we're all susceptible to this crisis in the same way we're susceptible to the coronavirus. Can you talk to us about the resources that are available? Where can we point people to get help?
Yes. So for those who have access to online internet, there are many resources online, whether it's sexual therapy services, links to mindfulness techniques, apps on your phone that you can download. I think those are all helpful ways to help individuals maintain awareness of their emotional sense, and even tools that can help support any symptoms around mental health concerns. MDHHS, the Michigan Department of Health and Human Services, has established a WARM hotline, or a WARM line, I should say, which is, I think, a very important source of support. And that number is 888-733-7753. And that WARM line is geared towards, is open for individuals who are experiencing any type of behavioral health concern. It's a peer-run WARM line, and so I encourage individuals to use that. Other resources at Hope Network, we're one of the largest nonprofit organizations in Michigan focusing on behavioral health, and we serve people from every county. And one of my roles is to really think about access. That's one of my concerns back up at the beginning of our talk here, is how do we keep access open to those who need it and those who want it and are developing symptoms. And so we are keeping our outpatient offices open through telehealth, and so services are still available. We have crisis services, we have addiction recovery services, and our number is 616-279-3725, individuals can reach us. We're also on Facebook and have a website at hopenetwork.org.
Thank you for that, Dr. Taylor. I think that's very helpful. And I want to thank you on behalf of all of us here in Kent County for all the fantastic work that you're doing and all the fantastic work that Hope Network is doing. You are truly a great partner in this community, and Hope Network is doing fantastic work to protect our community from mental illness and really putting us all in a better position to be successful. So thank you very much for all that you're doing.
Thank you. Stay safe.
Thank you, Dr. Taylor. And thanks to all of you for watching this COVID-19 update. I'm Dr. Adam London with the Kent County Health Department, encouraging all of you to please stay positive, please stay heroic, and please stay home. And I'll be back tomorrow with more information for you. Thank you.